AstraZeneca vaccine obviously is a very good vaccine for its primary cause. We've seen data that suggests that the mRNA vaccines given whatever the primary cause vaccination is gives a very good boost. And for a range of reasons, including simplicity in delivery of the program, we felt that overall there was a preference for mRNA vaccines for the third booster dose.
Yeah, so I think you had a kind of general question at the end there. So, June, would you want to say anything on that one?
Well, JVD, I'd just like to follow up on AZ and the regulatory position. Having looked at all the data, it is a safe and very effective vaccine. So no one needs to hesitate, and particularly as Wei Shen says, if the decision is that you would have it for your booster, then no worry at all, be reassured that it will be effective. So I hope that clears that up. In terms of longer term impact, we as JCVI will be following Public Health England's really helpful and impressive and timely work to make judgments. Thank you.
Thanks. So I'll try and answer your question a little bit. I think if there's good uptake of the booster dose, and I've absolutely no reason to doubt that at all. You know, the uptake in this country, particularly in people over the age of 50, has been nothing short of astonishing. So if there's good uptake, I think the booster programme will make a very substantial impact on keeping the lid on things COVID-wise in terms of hospitalisations and deaths, and keeping pressure off the NHS this winter. We want to live our lives as normally as possible from now on, and we want a normal winter life too, and a high uptake of the booster programme is going to give us a much increased chance of doing that, in my view. Hugo Guy, iNews.
Thank you. Obviously, the delivery of this booster campaign will be done by the NHS, but Professor Van-Tam, can you just say something about how soon you expect this to start, how long you expect the booster campaign to go on, and also can you say anything at all about where these are going to be delivered? Is it going to be necessary to set up mass vaccination hubs, or can it be done within permanent infrastructure at a time when obviously the NHS is under quite a lot of pressure anyway?
Sure. I'm glad to answer that question. So my personal view is that this needs to start very quickly. The NHS has been planning for it for quite some time, months, and I would expect that they, subject to ministerial go-ahead, which at the moment I don't have, but subject to that, I would expect them to be able to start in a short number of days, not a short number of weeks. I would expect the model, and again you really should ask the NHS for the proper details on this, but I fully expect the model to be a combination of mass vaccination centres and delivery through primary care. And of course the all-important domiciliary outreach to patients that can't reach normal healthcare settings and need to be visited in their own homes. In terms of how quickly can this proceed, there is a very clear understanding that it needs to proceed with good pace. And of course the advantage here is that this time patients only have to attend their vaccination location once rather than twice. So the simple maths says that it's quite obvious that it should be possible to go faster, in the sense that there are not second doses to factor in. But really you need a qualified opinion from the NHS England, who've really been all over this for months. So I encourage you to reach out to them and get some answers in detail from them. Thank you. Next question is Sam Blanchard from The Sun.
Thanks. The age cut-off seems like quite a fine line. Can you say what data you'll be looking at for younger adults and considering whether to roll out boosters for them, and whether they can be assured that 2 doses will be enough to see them through this winter? And also earlier in the year there was some talk about variant-specific vaccines. How confident are you that the current Pfizer jab is future-proof for the next 6 months?
Would you like to start on that, Wei Shen?
Okay, yeah, sure. Thank you. As you've probably worked out from the slide that was shown earlier, people who are 50 years and below without underlying health conditions would have been offered a vaccine, the primary course vaccine, much later. So they wouldn't have had their second dose until quite recently, really. And so even if they had immune responses that were similar to older adults, 6 months from their second dose would take them quite a long way into probably 2022, into next year. So we have time to try and understand more regarding how long their immune protection will last for. And when we have seen enough data, then we will be in a position to give further advice. What we don't want to do is for people to panic, if you will, and think that they need to have a booster dose straight away, because that may not be the case at all. Regarding variant vaccines, there are variant vaccines in development. The clinical trials that looked at the third booster dose also were tested to see if they neutralized variants of concern. And the immune responses actually looked very, very good against variants of concern. At the moment, at least, giving the current generation of vaccines appears to still be very good against the known and major variants of concerns that we have now. Clearly, if there's a new variant that emerges, then we'll have to understand what happens then.
The next question is Hannah Giesler at The Express.
Hi, thank you. In the last couple of weeks, some GPs were affected by delays to the deliveries of the flu vaccine. Are you confident that supply won't be a problem this winter for both flu and COVID? And secondly, recent ONS data suggests that around 4% of people might still be vaccine hesitant. We've obviously had really good uptake in the UK, but do you have any message for people who have still not had the first or second dose?
Okay, thank you, Hannah. So on the flu vaccine delays, that was from one manufacturer. My understanding is that that delay is very short, 1 to 2 weeks. I have absolutely nothing to tell you that gives me any concern about the supply of COVID-19 vaccines required for the booster programme. In fact, I believe it to be extremely healthy and absolutely no constraints on that. And I've forgotten the last bit of your question.
Have any message for people who haven't had the first or second?
Yes. It remains the case that going from no protection at all against this virus to the protection given by those first 2 primary courses is always going to be more important in public health terms than boosting. It sounds crazy to say it at a briefing which is all about the booster programme, but it's actually true. And so from that perspective, the NHS has been very clear that the offer of vaccination is evergreen for people who haven't yet taken advantage of it, and they can come forwards, and it's still incredibly important.
Could I add to that? And thank you for raising that question. I'm a clinician, and I see patients in hospital, as do a lot of my clinical colleagues, who have, unfortunately, been hospitalized because of COVID-19. A lot of them currently are people who have not been vaccinated at all, whether with 1 or 2 doses. And some of them, unfortunately, are very, very ill. I've spoken to patients who have survived an intensive care admission because of COVID-19. And during recovery, we spent a long time chatting, and they asked me, when can I have my COVID vaccine now? And of course, we want to wait until they've recovered from their illness before we offer them a COVID vaccine. But the important thing is, if only they had asked that question before they became seriously ill and ended up on intensive care, because we want people to be as well protected as possible. And it's always heartbreaking when you see somebody who is admitted very, very unwell, and they didn't avail themselves of something that would have protected them from such a severe disease.
So I'm going to take one more question from the gentleman at the back. I don't know who you are, so could you introduce yourself to the panel, please?
Sure. Alistair Smout from Reuters News Agency. You've been very candid about the fact it's uncertain how long protection will last beyond 6 months, but said you want a precautionary approach. But said this doesn't mean that there's necessarily going to be boosters in the years going forward. I'm just wondering how we're going to break out of a cycle of constantly boosting if, let's say, this time next year, we're still taking a precautionary approach because we boosted everyone last year, we don't have enough data, and then more and more vaccine gets sucked into the developed world doing boosters and not to people who are unvaccinated. Thank you.
Would you like to go at that first? And
Yes,
thank
you. So that's a very, very important question, and one that we've been wrestling with for a long time and still are. We certainly don't want to be in a situation where we are taking a precautionary stance every 6 months and wondering if we ever can break out of a cycle. That would not be a good position to be in. We want to understand and learn just how long protection lasts for. There are major efforts being made to understand how the measured immune responses, so things we can measure from the blood and so on, correlate with protection against severe COVID-19. And if we have such correlates of protection, it becomes easier to measure immune responses in people and then have some sort of projection as to whether further boosters are going to be needed and how soon after. The other thing that is of interest is whether the third booster dose, by giving such high levels of measured immune responses, might actually last even longer than the second dose. And so whilst the second dose, we have started to see some hints of some loss, although not very much, it may be that with the third dose, that's pushed out even further to many, many more months. So that's certainly something to be encouraged about. And the last thing I would say is we don't really know how natural infection will help in giving us mini boosts on their own. You can imagine a situation where somebody has had natural infection first and then a vaccine. We find their measured immune response is very, very good. And the same may be true the other way around, i.e. somebody who's had a vaccine and then gets a mild infection afterwards. That mild infection may act like a mini boost to their immune response so that they continually have a high level of immunity that protects them against severe disease whilst they might get milder illnesses.
So that's a very, very comprehensive answer from Wei Shen, one which I agree with entirely. And, you know, the JCVI advice today is bespoke. It is for this winter only, and we will ask JCVI to keep on coming back to this question until the whole world, indeed, has settled into some kind of normality in terms of having to live with this virus. But now is not that time. The pandemic is still in its final, I hope final, active stage, and therefore we are under special measures, if you like, including asking JCVI to look at what we need to do this winter. But in time, I suspect it will settle down exactly as Wei Shen has said. I don't know if I'm allowed to keep on taking questions, but go on.
Thank you very much. Lizzie Roberts from the Daily Telegraph. If someone in this group 1 to 9 chooses not to take up the booster, would you then consider that they are not fully vaccinated and therefore any COVID pass that they currently have would become invalid?
Thanks for the question. There is no current consideration of COVID certification in terms of the booster dose.
Would you consider that they wouldn't be fully vaccinated without the
I would consider they don't have the optimal protection on board as a scientist. Whether there will be a ministerial decision about what constitutes COVID certification or not for boosters is something that ministers will need to decide on in the future. But that's a long way off, because you can't put in those kind of rules until everyone's had the opportunity to be brought forward and offered the vaccine in the first place. So, you know, I'm pushing it into the, kicking the can down the road on that. I can be very clear that I would think that person was not optimally protected if the JCVI had advised that they should be. But in terms of, you know, what the government, what ministers decide on in terms of, you know, future COVID passports is not a matter we can really go into today. Final question.
Tom Harwood, GB News. I was just wondering, I've seen a lot of discussion about different vaccines having different longevity in terms of how protective they are, and some suggestions that the AstraZeneca vaccine might actually be lasting a little bit longer than mRNA vaccines. Was this something that has been considered at all in your deliberations?
I think that's actually quite difficult to answer. We don't really know how long the duration of protection is for most vaccines. You've seen some data that we've presented here. And I bring us back to the point that the primary aim of the COVID-19 vaccine program is to protect against severe disease. There are a lot of data regarding protection against symptomatic cases, but I don't think we can stop symptomatic cases completely, whereas we want a high level of protection against hospitalization and people dying, and that's really where we want to focus on. So asking that question of different vaccines with regards to hospitalization is much more difficult.
Okay, well, thank you, June. Thank you, Wei Shen. Thank you all for coming. Nice to see some of you. And this briefing is now closed.